If you've ever finished a procedure on a patient, only to look at a pile of used and discarded supplies and think, okay, what do I do with this? You're not alone. Waste disposal in the hospital can feel like a convoluted and confusing process, but it's also extremely important. Improper disposal leads to a lot of issues, like fines and other added costs, drug diversions, patient and staff safety concerns, and personal injury. So in this video, we are going to take a closer look at the intricacies of hospital waste management. Let's begin by identifying the different places we can dispose of things at Trinity Health Livonia Hospital. The easiest place to start is the trash can. Located in every room and throughout the hospital, it is arguably the most versatile of waste containers. The linen bin, or hamper if you prefer, located in every patient room, and where it's not technically waste, as the contents are laundered and redistributed, it does play a key role in this discussion. All linens should always be put in the linen hamper. The sharps container. Never a dull moment when you've got to use this readily available canister. Needles, stylets, guide wires, razors, lancets, scalpels, anything with a needle or a blade goes in the sharps container. The pharmaceutical waste container, or as I refer to it, the black bin, that can be found in all pod rooms. This is for medication waste for non-controlled substances. The Stericycle controlled substance container, also available in all pod rooms. This is for medication waste of controlled substances. And last but not least, the Vibrant Biohazard bin, located in your unit's dirty utility room. This is for items containing or soaked in bodily fluids. Now that we know the players, let's set the scene. After an exhausting rapid response on your patient, you look around the room and realize, somebody's got to clean up this mess. And you're the only one here. EVS will finish the room, but they aren't responsible for medication waste, sharps, or bodily fluids. That's the nursing staff's responsibility, so you may as well get started. You see a collection of medication paraphernalia on the side table. Well, that's as good a place to start as any. There's a nice pile of medication containers here, and you pick up an ampule and its detached top. You didn't even realize anyone used these archaic things anymore, but whatever. You know this should be disposed of in the... Do you place the ampule in the trash can, the sharps container, or the black bin? Correct! Ampules are broken glass, and all broken glass should be disposed of in the sharps container, because, you guessed it, broken glass is sharp. Next, you pick up 2 medication vials. One seems to be empty, and the other still has about half of the volume of liquid in it. You take the empty vial and confidently drop it into the sharps container, the trash can, or the black bin. Correct! Empty medication vials can be disposed of in the trash. Many may inappropriately throw these in a sharps container, but not you. You know it's safe to dispose of these intact vials in the trash. The half-full vial is in your other hand. Looking at the label, you read that it is cardizem. Since this is not a controlled substance, you know this can be placed in the sharps container, the trash can, the black bin, or the Stericycle container. Correct again! As long as the medication is not a controlled substance, vials that still have medication in them can be thrown in the black bin, which is for pharmaceutical waste. No need to empty it out first. If you have pills that were opened and not taken, or IV bags that didn't run empty, unfinished eye drops, medicated creams, etc., those can all be thrown in the black pharmaceutical waste bins in the pod room. If that half-filled vial had been morphine, well, that's a different story. Controlled substances cannot be thrown in the black bins. Instead, you would need to empty the contents of the vial before disposing of it. Grab a buddy to witness. Then draw up the remaining morphine. Note how much was left in the vial. Squirt the medication into the Stericycle canister in the pod room. Now the empty vial can be thrown into the trash can. And then, don't forget to document the wasted controlled medication volume in the Pyxis. The Stericycle canister isn't only for IV controlled medications either. If you have pills like Norco, or patches like fentanyl, those are still controlled substances, and should be disposed of in the Stericycle canister. There are also some empty syringes on the table. One has a needle attached with a protective cover in place over the needle. The other is an empty 10cc syringe with no needle attached. You take the first syringe, the one with the needle, and place it in the trash or sharps container. Excellent work! The needle needs to go in the sharps. Don't worry about detaching it from the syringe. No need to fiddle with a needle and risk an accidental poke. The whole thing goes in the sharps. Now that other syringe that doesn't have the needle, that should go in the sharps container or trash. Right! No needle means it's not sharp, and if it's not sharp, it can, and should, be thrown right into the trash with no concerns. You move on to the IV pool, where you see 3 bags still hanging. You take down the saline bag. You know this can be drained into the sink and then thrown into the trash, or should be placed in the black bin without draining. Correct! Saline can be drained into the sink, and the empty bag goes into the trash can. But what do you do with the tubing? Place it in the sharps, the black bin, or the trash can. Wow, you're good! That's exactly right! Even though many people put tubing in the sharps container, you knew it should be thrown in the trash. Since the IV spike is a bit pointy, it's not a bad idea to reattach it to the saline bag before throwing it away to protect the trash bag from getting a nice big hole poked through it. When tubing is thrown into the sharps container, it takes up valuable space, leading to premature filling of the sharps, which the hospital has to pay to be emptied, leading to increased cost to the hospital as it requires more sharps containers. This is the same reason that needleless lure lock syringes go in the trash, and not the sharps container. The second bag is a half-finished cardism. This should be drained into the sink and thrown away, or placed in the black bin without emptying. Correct! Medications need to be disposed of in the pharmaceutical waste bin. The only fluids that can safely be drained down the sink are saline and electrolyte bags. Medications need to be properly disposed of in the black bin. Before throwing IV medications away, though, make sure to black out any patient information, regardless of if this bag is empty and going into the trash, or still filled and going into the black bin. All patient information should be blacked out with permanent marker. We also have the option of tearing off the label, and then throwing the label with all the patient information into the shredder box, used for all papers containing patient info, located at all nursing stations. You also see an empty unit of blood and blood tubing hanging from the pole. This should be thrown into the sharps, the trash can, the black bin, or the biohazard bin. Biohazard bin for the win! The biohazard bin is used for all blood product bags and blood product tubing, no matter if they are empty or still containing some blood. It is also for any blood-soaked pads or diapers, or drainage containers that cannot be emptied. Empty containers, like Foley bags or suction liners, can be thrown into the trash. Sometimes you may see a drainage container that can't be emptied. That full container goes into the biohazard bin. Never put linens into the biohazard bin, though, regardless of if they are soaked in body fluids or not. Linens go to linen. We'll touch on that shortly. Well, that looks like all the med waste, but geez, did no one even try to clean up in here? There's a couple of used, already retracted IV and butterfly needles. Well, that one's easy. All needles go, you guessed it, in the sharps. You also see a removed IV catheter, wadded up in a Tegaderm dressing and still attached to the small IV extension tubing. With confidence, you throw this into the sharps container, throw this into the trash, or throw this into the biohazard bin. Slam dunk! It goes straight into the trash. Often, people put this in the sharps container, but the sharp needle was removed from the catheter when it was inserted. All that's left is the plastic catheter, and that plastic is just trash. There's also a urine sample cup, complete with a little urine left. You throw the whole thing in the sharps. You throw the whole thing in the trash. Or, you dump the urine in the toilet, throw the lid in the sharps, and the cup in the trash. Right! Get rid of the pee and separate the parts. There's a needle in the lid, so it has to go in the sharps, but the empty cup can go into the trash. Speaking of things that hold urine, if you have a Foley that was just removed, any remaining urine should be drained into the toilet, but that empty Foley bag and tubing can be thrown into the trash. There are also a couple of cups still filled with water here, and you might as well clear those up too. You know you can throw them directly into the trash, or empty them into the sink and then throw the empty cup into the trash. Absolutely! No one wants a trash bag filled with liquids. That's a recipe for disaster. Empty it and then throw the cup away. Well, looks like that takes care of sharps and medications. That leaves the bed. There's a procedural pad soaked in blood. You deposit that in the trash, hamper, or biohazard bin. Well done! Any pads, diapers, etc. that are soaked in blood or other body fluids should be taken to the biohazard bin. You pick up a bundle of washcloths, also soaked in blood. These also go in the biohazard bin, should be thrown into the trash, or should be thrown into the linen hamper. Nailed it! Linens always go in the linen hamper. It doesn't matter if they're reasonably clean looking or soaked in God knows what. They go in the linen hamper. The hospital does not buy linens. We basically rent them. By the ton. And when we return them, they are weighed. By the ton. If we ordered 4 tons of linens, and the company picks up the dirty linen bags and weigh them at 2 tons of linens, We're on the hook for that missing 2 tons of linen. Where did they go? Well, we threw them out, most likely. For whatever reason. The hamper wasn't close, but the trash was. I looked at this and said, no one should ever have to touch this disgusting thing ever again. I'm throwing it out. It doesn't matter. Do not throw linens away. They always go in the linen hamper. They're just not ours to throw away. If you pull a clean linen from the pod room and notice a spot or stain or a tear or a rip in the fabric, what do? Quietly replace it on the linen cart and grab a new one? Throw it away? Draw a big black X on it with permanent marker and throw it in the linen hamper? Or tie it in a large knot and throw it in the linen hamper? If you chose tie it in a knot, you're spot on. We never throw linens away. But if we identify that it is ruined, we can signal this to the linen company by tying a knot in the cloth and placing it in the hamper. When they launder it and see the knot, they'll make the decision whether to dispose of the piece or not. But we have fulfilled our obligation of returning that product to them. You strip the bed, throwing all dirty linens in the hamper. As you remove the pillow slip, you notice the pillow has some unpleasant stains too. You try to clean them off, but they aren't going anywhere. This pillow should be thrown in the linen hamper, be thrown in the trash, have a big black X drawn on it and put it in the dirty utility room, or scrub it with gray top wipes and reuse it. Good job! Throw that thing out! The hospital does buy pillows. Regularly. A lot of them. They begin their likely very short lifespan in the ED, where they are placed on beds and stretchers for patients, and they eventually are transported to the inpatient units with those patients. When those pillows have stains that won't wipe off, or if they're torn, or they're just too worn out to be useful, throw them away. Make room for the new pillows that will be coming up soon. Looking around the room, the only thing you seem to have left is a partially filled suction canister on the wall. You remove the liner and empty the contents into the toilet and throw the liner away, cap the liner and put it in the biohazard bin, or cap the liner and throw it in the trash. You're finishing strong! You empty the container into the toilet and dispose of the empty liner in the trash. If the container had no way of being emptied, it would have gone to the biohazard bin. But that wasn't the case with this device. Probably the most common body fluids are urine and stool. If you have a commode with a full bucket, that bucket must be emptied by nursing staff. EVS is not responsible for the disposal of any bodily fluids, so if a commode is in the room, it is expected that nursing staff will dispose of those contents. Now you've got some very full bags of trash and linen. You should put them in the dirty utility room, dump their contents down the trash and linen chute, and then throw the empty bags down the trash chute, or securely tie the bags and dispose of them down their appropriately labeled chutes. Nice work! You knot those bags up nice and tight, and put them in the trash and linen chutes respectively. You know you never put loose trash or linens down those chutes, only securely tied bags, because when you let go of that bag, it drops. Hard. All the way from whatever floor you're on into the basement, and if loose items or untied bags take that fall, that room that they land in quickly becomes disgusting, and somebody ends up having to clean that mess up. But you're more conscientious than that, so you always make sure your bags are secured before letting them drop. Wow, that was a doozy. But you did a great job. When it comes to waste, there's a place for everything and everything in its place. You're keeping patients, staff, and yourself safe by ensuring everything is properly disposed of and not wasting hospital funds that should go to supplies and equipment instead of fines and extra charges. We owe you a debt of gratitude. Now get back out there. Your patients need you.